adding medications to intravenous fluid containers. Check accuracy and completeness of each medication administration record or computer printout with prescriber's original medication order. Check client's name and medication name, dosage, route, and time for administration. Recopy or reprint any portion of MAR that is difficult to read.
Okay.
Assess client's medical history. Collect information necessary to administer drugs safely, including action, purpose, side effects, normal dose, time of peak onset, and nursing implications.
Your medication book.
When adding more than one medication to intravenous solution, assess for compatibility of medications.
Okay.
Perform standard steps. Assess client's systematic fluid balance as reflected by skin hydration and turgor, body weight, pulse, and blood pressure.
So that means you will go into your client's room and you're going to do an initial assessment on your client and then come back to your cart, making sure you've looked at his turgor, make sure you look at the site, make sure there's no swelling or anything, that the IV is infusing with no problems, and how their vascular system is at this time.
Assess IV insertion site for signs of infiltration or phlebitis, and assess patency of existing IV line. Assess client's understanding of purpose of medication therapy.
Okay, so while you're in the room, you're going to make sure that they understand why they're getting an IV, and if you're changing the medication, what the new medication is going to be. So of course, you're going to educate your client.
Prepare medication. Use aseptic technique. Be sure to compare the label of the medication with the MAR 2 times while preparing the medication. First check.
Okay, so I get my medication, I take it out of the drawer, and then I check it against my MAR. That's my first check. Making sure I look at expiration date. Expires June 2016. I look at the medication. It's clear. It's not cloudy. There's no sedimentations in it.
Perform hand hygiene. Compare labels of medication and IV fluid bag with MAR.
Again, you look at your expiration date, your solution, of course, your bag, and then you look for your expiration date. Okay?
Add medication to new container. Usually done in medication room or at medication cart. A. Solution in a bag. Locate medication injection port on plastic IV solution bag. Port has small rubber stopper at end. Solution in a bottle. Locate injection site on IV solution bottle, which is often covered by a metal or plastic cap.
Okay, so if you don't have a bag, you could have a bottle, and at the end of the bottle is a metal cap, so you would identify that metal cap. It looks similar to this. Okay.
Wipe off port or injection site with alcohol or antiseptic swab. Remove needle, cap, or sheath from syringe and insert needle of syringe or needleless device through center of injection port or site. Inject medication.
Okay, so I need to draw up my meds just like you did last week, making sure that you clean your port, allow it to air dry. You've calculated how much medication you have to add into your new bag. Make sure your vial is down. Put the air in the center of the vial. Make sure that your needle does not touch the medication. Flip your vial up. you have the correct amount. Do you have any air in there? Same method that we did last week. You're going to tap your syringe, getting the bubbles out, in order to determine do you have the correct amount of medication. Okay, you've already cleaned your port. Okay, now what's important is you hold your bag, your port even. You don't want to have your port bent, because a lot of times what will happen is if you do that, you may pierce through your bag, and then you've contaminated. You'll have to throw that bag out. So you want to make sure that you have your bag flat and even. Okay. In the center of your port again, don't stick yourself, and inject your medication into your bag. Okay.
Mix medication and IV solution by holding bag or bottle and turning it gently end to end.
Not shaking, just tilt it back and forth.
Complete medication label with client's name and dose of medication, date, time, and nurse's initials.
Okay.
Apply it to bottle or bag.
Okay, so I've already completed my label, and you have your identifying information, your patient's name, your medication, what you've added to this bag, and your date, your time, and it has on here what bottle it is, like if it's maybe the third bottle for the day, so you can actually put that on there. Okay. Now, this is a 500 milliliter, how about if I turn it this way? This is a 500 milliliter label for a 500 milliliter bag. And then if you had a liter bag, you would have a liter label. Okay, so make sure that you obtain the correct one. You're going to line up your 100 milliliter with your one on the side of your bag. Okay?
If new tubing is required, spike bag or bottle with IV tubing and prime tubing. Second check.
You can, for what we're going to do today is we're going to actually take, I don't need new tubing. We have tubing in the room. So I'm taking in a brand new medication bag. So I'm going to be taking that bag down, keeping my same tubing that I hang. So let's say if it was 24 hours or whatever the policy is for your facility, then you would be putting new tubing in. But for this patient, I don't need new tubing. I'm just hanging a new bag.
Bring assembled items to client's bedside at right time and perform hand hygiene.
So I'm going into my client's room. I'm going to, of course, close my MAR, lock my cart. There it goes. Go into the room, knock on the door. You greet your client when you go in. After they've acknowledged that you're there, greet your client and wash your hands. Wash my hands. Introduce yourself to your client. Hi, I'm Annette. I'm your nurse for today. Can you please state your name, full name, and date of birth? Give me the full name and date of birth, and then I'll check your ID band. Make sure that matches. Make sure it matches with my mark.
Identify client using at least 2 client identifiers. Compare client's name and one other identifier on MAR, computer printout, or computer screen with information on client's identification bracelet.
Okay.
Third check. Ask client to state name if possible for a third identifier.
Okay, so my client's already stated his name. I'll compare my medication at the bedside to my MAR again. Make sure it's the correct med and the correct patient. Tell my patient, I've already educated my patient when I came in earlier, and I told the client what they were going to be getting. a new medication through the same line that they already have, so they know that they don't have to get stuck again. All I'm gonna do is change the bag, and they're happy about that. Okay.
Connect new infusion tubing or spike container with existing tubing. Regulate infusion at ordered rate.
Okay, so I'm gonna take this bag. Making sure that you maintain asepsis, don't contaminate. Oh. Okay, see? Make sure you don't contaminate where you're going to, don't touch your spike and don't touch your insertion port. Insert it all the way in. Doesn't drip, and it has like a little line that you have to make sure that you insert it to. Okay, great. I'm gonna have to lower this for you guys because I know I'm tall and most of you probably can't reach that. Okay, here we go. Now.
Add medication to existing container.
Okay, so before she reads that, sometimes all you're doing is you're adding, the doctor may order just that potassium be added to the present bag. What we did is we added to a different bag. So the doctor may order for it to be added to the present bag. So you will be coming in with your syringe, you'll clean your port, and you're going to add it to the present bag. That's what you're going to read now.
Prepare vented IV bottle or plastic bag. Check volume of solution remaining in bottle or bag. Close off IV infusion clamp. Wipe off medication port with an alcohol or antiseptic swab. Remove needle cap or sheath from syringe. Insert syringe needle or needleless device through injection port and inject medication.
Okay, so what the skill is telling you is that if you're going to be adding medication to this bag, you need to close off your clamp. You need to identify how much solution is in that bag. Take the bag down, add it to the bag, invert it back and forth, make sure you mix it properly, completely, and then hang your bag back up. Okay?
Complete medication label and apply it to bag or bottle. Regulate infusion to desired rate. Use IV pump if indicated.
Okay, so I would be either counting drops or I would be hooking it to my pump.
Properly dispose of equipment and supplies. Do not cap needle of syringe. Discard specially sheathed needles as a unit with the needle covered.
Okay, so whether you use a biohazard container in the room or on your cart, or bring it in on your cart, one or the other, make sure you dispose of it properly.
Perform hand hygiene. Observe client for signs or symptoms of medication reaction.
Anytime you're starting an IV or you're adding to an IV, you're going to ask your client, is it burning? Do you have any sensation at the site? You're going to observe the site. You're going to look for any redness, any swelling. You're going to make sure that they're not having any complaint. It looks good. Your flow is going. Okay?
Observe for signs and symptoms of fluid volume excess.
Okay.
Periodically return to client's room to assess IV insertion site and rate of infusion.
Okay. So you're going to look for any reaction. So look at their arm. Make sure their arm looks good. There's no redness going up the vein. There's no phlebitis or anything like that. So make sure you do that initial assessment because you're going to go and document that. Now, if you come back in an hour and, oh my goodness, now they have this red spot, you know that they're having an allergic reaction to the medication. So again, your initial assessment is vital. All right, I'm going to be back to check on you in about an hour.